Hi, I'm Chris Urquhart with Natural Awakenings magazine, and I'm here today with Dr. Yale Smith. He has an extensive background, so I'm going to use my notes to make sure I can share with you many of his accolades. Dr. Smith has been practicing medicine for over 33 years. He's a diplomat of American Board of Anesthesiology and also an expert and senior specialist in anesthesiology by the State of Israel. He moonlighted as an emergency room physician during his residency. He currently licensed to practice medicine in 6 states. He is an advanced fellow in anti-aging, metabolic, and functional medicine, board certified by the American Board of Anti-Aging and Regenerative Medicine, and in finishing a fellowship in integrative and metabolic cardiology, which deals with preventing and reversing hypertension and heart disease. So there's quite a bit there, and we're going to see how much great information we can get out of Dr. Smith. So thank you so much for joining us.
Welcome.
So right now, we are all learning more about respiratory issues than we probably have thought about in the past, and we're learning how serious they can really be. And you have some personal experience at severe respiratory illnesses. So could you maybe share a little bit about your experience and also how you went about rebuilding your health after that experience?
Sure. So I think it's been about 4.5 years ago, I returned from Israel where I was training residents in doing private practice anesthesia. And I was a professor there. My mother was ill. I had to come back to the States. So I was working at a hospital doing anesthesia, and a younger anesthesiologist was on vacation, and he came back from vacation. He introduced himself, and he coughed right in my face. He was only probably less than 6 inches from me. And unbeknown to any of us, he had a contagious respiratory illness, and within several weeks, there were 14 people in the operating room that contracted this. I got the brunt of it, and I was working long hours, taking call, which means I worked all day, and then I did every case that came through the ER or emergency that night. I could work, and sometimes I was working all weekend, from Saturday morning until Monday. So I was stressed and not sleeping, not eating properly, and I was immunosuppressed. And I started coughing, and I didn't have time to see a physician. And like most physicians, we write prescriptions for, things, antibiotics, stuff like that. And I, over several weeks, became really sick. I returned home after being on call on a Thursday and working from 7 in the morning until 4 a.m. straight through. And I went and slept for an hour and then drove home, and it felt absolutely terrible. Within 48 hours, my uncle came to visit me, and I was completely disoriented. I was severely hypoxic. In other words, I didn't have enough oxygen to supply my tissues with nutrients into my brain. And I was rushed into a local hospital. They did CT of my chest, did even pneumonia, and you need to come into the hospital. That's essentially all I remember. I was admitted. I don't even remember what floor of the nurses, and within a short period of time, I developed ARDS, which is acute respiratory distress syndrome. And because I practiced at this hospital, people knew me there, and it transferred me to the ICU, where I was intubated. A tube was placed down my throat, and I was put on a ventilator, and I lapsed into a coma. And I was in a coma 6 weeks. My lungs, both lungs whited out completely, had infection. I was on, from what I understand, multiple antibiotics. They couldn't figure out what was wrong with me. They thought it was something I contracted in Israel. It wasn't. And at a certain period of time, they took me to the operating room and they did a trach on me, a tracheostomy, because the endotracheal tube was in too long and they were worried about vocal cord paralysis. I don't remember any of that. I woke up 6 weeks later. Surprisingly, the pulmonologist wanted to take me off the vent, let me go after, and I didn't know this either, but at a period of time, I went into organ failure. My kidneys started to shut down. I coded twice, where I died twice in the unit. And they did 2 full codes on me. And surprisingly, I woke up 6 weeks later, and I can remember, the first thing I remember was, why is my throat so sore? My brain was asking. And I woke up and I didn't know, I remember the nurse came in and saw me and she said, Dr. Smith, you're awake, you're awake. And they called all the specialists. I had a problem with one of my eyes. I thought I had a stroke because it wouldn't move properly. Found that that wasn't it. And I was being taken care of by some of my colleagues. And after I was stabilized and I could be transported with oxygen through a trach, they sent me to see Pines. And I spent another, I don't know, month and a half there learning how to walk again. I developed what they call critical illness neuromyopathy. I couldn't even lift my hands. Here, I did open heart anesthesia, and I was able to intubate patients, put lines in them very quickly. I couldn't even lift a spoon. They had to give me a sign to wave flag to the nurses to get their attention. And I was told that it was a miracle I survived, because most ARDA or AD, acute respiratory distress patients, don't survive because they're severely hypoxic. And I had two codes run on me. So they kind of said, you know, and people tell me that I was a miracle that I survived. So I was doing inpatient rehab, and then when I was discharged, I went back there and I was doing outpatient rehab for 2 years, over 2 years, learning how I had to rebuild my body. At a point, I was coughing constantly. I couldn't even have a conversation with anyone. And my colleague, who saved me, who's like an adopted older brother, the cardiologist, Robert Barden, said, listen, you're still coughing. And I would go from one doctor to another doctor, and they would give me all kinds of prescriptions. And my house looked like a Walgreens pharmacy. Okay. And here I was, you know, very thin, very frail, aged, that, you know, several years from the stress that my body went through. And I started to wonder, start looking up the side effects of all these drugs. Now, as an anesthesiologist, I knew about all the different drugs and how they impacted the patient's physiology, and I knew about all the anesthetic drugs and how to use them. But this was different because this was me, and I found that a lot of my colleagues would just give me, I'd go and wait and see them, and they give me a prescription, and then I'd have all the side effects. And at one point, I was on like 15 different medications. And there were points where I, you know, was very, very sad, because here I was very active in practice, and I had to retire because my lungs were permanently damaged from the infection and the scar tissue. So, sorry, this is a chronic thing. I decided to, although my colleagues here were very good, I went to National Jewish Health, which is in Denver, Colorado, and it's the #1 pulmonary hospital in the country. It's been that way for over 100 years. And the head of the hospital, I contacted him as a physician. You know, we have some perks. Most patients don't have this ability, but being in medicine for 33 years, living in 2 countries, working in multiple states, you know how to navigate the system. And so I went out there and spent a week there, and they ran all kinds of tests on me, putting tubes down my nose for 26 hours, doing all kinds of stuff to figure out what was wrong with me. And they did, and I came back and I had 2 surgical procedures, which freaked out my family and the anesthesiologist because of what my prior history. Then I decided, okay, I'm going to look into all these different medications and started to look at what can I do to improve my health and to get off a lot of these drugs. And I remember telling the physician out there, he had me on something. I told him, I'm going off this stuff. It makes me feel worse than, and it's not doing me any good. And that's when I started to get into the more holistic, integrative, functional medicine area of medicine, and had to rebuild my body from the inside out. If you met me in person, you would never know. But we have photos of me when I was in a coma, and it's very drastic. It's a picture's worth 1,000 words. You look at this, and it is.
Mm-hmm. So you attribute your return to health to your discovery, I guess is the right word, of a more of a functional medicine approach to your lifestyle, your health. What are some of the main things you feel like rebuilt your health? Things that you changed?
Well, one of the main things I think was getting proper sleep hygiene. As an anesthesiologist on call, you're trained to wake up in the middle of the night and just go do a case. And for many years, that's what I did. I could be, sleeping 15 minutes and get the pager or the phone would call, we have an emergency heart. I would wake up, and you could be up all night. So most of the physicians are very, they don't take care of themselves at all. So sleep is really important. Diet, exercise, lifestyle changes. I never really exercised before, never had time, wasn't really interested in it, although I'm small, small frame, 5'6". Now I'm mostly muscle mass. So diet, the American diet is very, very poor. It has a lot of bad things in it, a lot of preservatives. If you go and eat plant-based diets, which means if you had a plate and you had vegetables, multicolored vegetables that have olive oil, garlic, low salt, lots of fruits. Fruits meaning berries, blueberries, blackberries, strawberries. They have huge antioxidant and vasodilating effects and protect you against cellular damage from stress. So if you have a diet that's plant-based, and not everybody likes salad or eating vegetables. Most Americans don't. They like, crap. They'll hit McDonald's and that's their food. But if you eat a plant-based diet, it has a huge protective effect from cells or on the cells to protect the body from stress. limiting sugar, refined sugar is really bad. Glycated sugar causes oxidation of LDL, the lipids, which then causes huge immune responses to your body. Your body attacks these, and then you develop plaque in your vessels, and these plaque can rupture, and that's where patients develop acute coronary syndrome, and they could die from this. Exercise is really important. 50 minutes a day, 60 minutes a day, mostly resistance, 40 minutes of resistance, 20 minutes of aerobics. Resistance training can be anything. I have a water rower that I get on, and then I alternate that with a total gym or kettlebells. Anything that's weight, that using weight will build up muscle and increase hormones, to testosterone, estrogen, all these things that your body uses to protect against disease. And then taking things that will stimulate and protect your body from stress. Sugar is one of the worst things, and it's in everything. So patients that are pre-diabetic or have metabolic syndrome or diabetes are at huge risk for cardiovascular disease and all types, renal failure, all these things that destroys your body. Patients that they use a lot of sodium chloride in their salt, regular table salt, has huge damaging effects to your body, to the vasculature, and that's why patients develop high blood pressure and cardiovascular disease. Most of the diseases are preventable, almost all of them, if you have the right testing and have someone to guide you into how reversing this.
So as a functional medicine doctor, you do those as a standard intake. If someone comes to you and says, I don't feel good, here's what's going on in my life, I'm tired all the time, I don't know why, I don't have time to eat properly, et cetera, et cetera, et cetera. There's you would run a host of tests that would be mostly blood work, I presume, possibly
Yes.
Saliva, urine.
So somebody comes in, most physicians, and I go to my colleagues. You walk in, you sit there, you wait, you sign in, you pay your copay, and you sit on your butt, and then they go back and they take your blood pressure, and you go see the doctor. They listen to you, the heart, lungs, how you feeling, this, that, and then here's your pill out the door. When they come in to see me, there's a long intake form on the computer that goes over everything from the time they were born till currently, everything about their sleep, their hormones. From then, we ask them about ED, we ask them about their heart, their hormones, all these things, because they're all interconnected. They all work together. And then they come in and I go through even more detail. They're with me for an hour, between an hour to an hour and a half to 2 hours. And then I tell them we do extensive lab work on that. Blood work, we have them do salivary cortisol testing to look at their hormones and their sleep issues. And we do special testing that nobody's doing here within 150 miles for cardiovascular prevention, to look at how high are they at risk developing an MI within 5 years. We look at their genetic markers for cardiac disease and high blood pressure. We look at micronutrient testing. And then I get all this information, And then I dive into it to see where is the smoking gun. Where did this originate from? And then I pull them back in, explain everything, then put them on a personalized treatment protocol, which includes changing their diet, their lifestyle, an exercise routine, and then we get into how to correct these issues to prolong their life and how to reverse things. As a former cardiac anesthesiologist, like most interventional cardiologists, it would be nice to prevent this thing because it's very expensive to have bypass surgery or stents or any of this stuff, and you're on medications, and the morbidity of it. Some of these patients don't pull through.
So it seems like it's probably a pretty common thought process that, you know, you're going to check their cholesterol and be able to tell them about their heart. But you have a lot of other indicators, I believe, that would indicate someone might be headed down the path of heart disease even before they know they have a serious problem. Is that true? There's some things that you can,
Yes.
you mentioned earlier, you want to prevent things and you can help reverse disease. And so that's kind of why I was thinking it's not just a cholesterol test. Isn't that true?
No, it's much more. We don't look. I had a patient recently who was told her cholesterol was normal, and she came in to see me because of serious issues. And we did all these specific biomarkers for lipid breakdown particles and inflammatory markers, and looked at not only that, we looked at how high risk she was of having an MI by inflammatory markers, and also her genetic SNPs, genes that she got from her parents and her grandparents on both sides that she ended up with, and found out that she had many abnormalities that caused her to have these issues. And although we can't change the genes, we can change the expression of the genes by turning things on or off. And that comes with sometimes medication along with diet and nutraceuticals. So it's a combined thing. We can, you know, the things that we're doing are sort of cutting edge.
Mm-hmm.
A lot of my colleagues don't even know about these things. I have to educate them about these specific testing and how they work.
Yeah, I find it extremely exciting that you can look at the person's genetics and make lifestyle changes. I mean, things that we can control in our everyday lives just to turn these things on or off and really extend you're talking about extending someone's life. I mean, truly, when you're looking at heart disease and all of that, if we know what's going on in our own body and you help people be able to see those things, it can make a huge impact on someone to make changes in their life. I've seen that.
It's interesting when you have a patient that comes in and tells you they're in their 40s, and they tell you, yeah, I'm doing this and I'm doing that, and you do these specific tests and you show them, well, here's your inflammatory markers of what's going on at the cellular level and what's going on. And then you show them, here's your chronological age and here's your heart age. Mm-hmm. And when they look at it and they're in their 40s and you tell them and you show them the numbers that they're over 80 years old with their heart age, it's a wake-up call. And they want to do everything they can to change that.
So,
and
I'm sorry. So for you to do that, I assume you don't just give them the protocol and send them out the door. You're a partner in their ongoing health. Isn't that true?
Yes, I'm like their coach. I explain to them all the medical things that are going on, all the physiology, what the labs show, why it shows this. And then I come up with a treatment protocol for them, and they keep in touch with me, and then they come back within 3 months, and we check their labs again to show them, hey, you're making some progress with this. And this is what we're trying to accomplish. It's sort of longevity for them to live longer, especially when you have someone in their 50s who has bad genes, you know, and they go to their doctor, hey, your cholesterol is fine, your LDL, don't worry about it. You know, we look at very, very deep dives into their physiology.
Right. This is about when you change your lifestyle, you're also changing how you feel and how you're going through life. So all those aches and pains and swelling and things that come from, being inflamed and many other things you've described, with your type of approach, you're talking about not just length of life, but quality of life as well.
Exactly.
So it sounds like, in my personal opinion, I believe functional medicine is the future. And it's something that we're working really hard to make sure people know about, because it's all about staying healthy and living life and wellness and living our best life. So what you're doing, I think, is really amazing and really important. And with your perspective of your own personal background and your heart expertise, you have a unique take on making sure we have a healthy heart. So you mentioned a couple of things. I just wanted you talking about sleep and how important sleep is. But you also have mentioned that melatonin can have a benefit, not just with sleep, but perhaps with viral connection as well.
Well, my sister called me, and like everybody else in this country, we're very, very concerned about this COVID virus and how susceptible patients are to contracting this. So there's two thoughts. One is that patients that are immunocompromised, in other words, patients that don't take care of themselves, they have emphysema from smoking, they're bad diabetics, cardiac disease, had an MI, stents, bad low ejection fraction of their heart, all these different things, they are at higher risk because their immune system can't attack the virus. Then you have the other extreme. That was like me, who was around thousands and thousands of patients over the years that were sick, and my immunity was very, very strong, and my own immune system was attacking my own body. So we've done some research, and in the former COVID infections, they showed that melatonin at 3 milligrams had a beneficial effect on helping kill the virus. And melatonin has multiple effects besides sleep: antioxidant, antiviral. And I'm not saying that it's going to help with COVID-19, but they have shown in prior COVID infections that it had a beneficial effect in ameliorating the virus.
Was melatonin something that you would say someone could just go to the health food store and pick it up and take at will, or do they need to consult a physician on the proper dose and know why they're taking it?
It's the usual doses, like 3 milligrams at QHS at night before sleep. But you can have some weird dreams with it, from it. But it has been shown to have some effect. But in former viruses that were tested,
right?
I don't know about this one.
Yeah. Well, I think all of us are getting a crash course on viruses and what to do and what not to do in order to stay away from them, I suppose.
Well, I think that one of the important things that we see every night is Dr. Fauci on the news telling us to social distance, and that's very important. Keep 6 feet away, to wash your hands with hot soapy water for 20 to 30 seconds, to see if you can get a mask to wear. And I can tell you, there were thousands, I would go to the OR and I'd take a mask and wrap it around my face before I go in the OR, and there were just boxes and boxes of them always. Today, it's very hard to even find them. I had to ask a couple of my colleagues if they can get me a couple, because, I'm not, and then I don't practice anesthesia now, I'm retired, and you can't find these things. Just like you can't find these, alcohol-based hand sanitizers. It's very difficult to find these things, and so what you do is try to wash your hands as much as you can and social distance from people. And, if you develop symptoms of you just don't feel well, someone can be psychosomatic because all we're hit with is all the stress from this. But if you start spiking a temperature, take your temperature. If you have a sore throat, cough, dry cough, these are symptoms you have to be very careful, and you need to consult your physician, and especially an infectious disease doctor that specializes in this kind of things. So,
well, Dr. Smith, thank you so much for sharing your story and sharing some things that we can do to stay healthy, not just now, but going forward, so that we do have quality and quantity of life and can enjoy our own health. We really appreciate it. So those of you that want to connect with Dr. Smith, his office is located at 7000 Spyglass Court, Suite 300 in Viera, Florida. If you want to read more about him, antiagingim.com, or give their office a call, 321-421-7111. Again, thanks for joining us. And everyone, be well, stay connected.